Joe, can you help us understand how doctors nowadays treat lung cancers with MET mutations?
So, as you pointed out, there are different kinds of MET mutations. We have some targeted therapies, actually oral pills that can turn off the mutation for a very specific type called an exon 14 skipping mutation. It's a long name, but it's a very specific type of MET mutation and the most common type, fortunately. And basically, these are oral medications that turn off the function of that gene, which is really driving those cells to become cancerous. And so these have been really important options for a specific kind of lung cancer that allow us to treat it in an easier way instead of chemotherapy, and also fortunately very effective way. These drugs can be very effective in controlling these kinds of cancers and helping people live longer and better. And so the two that are currently approved are called capmatinib and tepotinib. They both do basically the same thing. They haven't been compared to head. And so whether one or the other is a better option is just something to talk to your doctor about. We don't really know, frankly, if one is better than the other. But like many of these targeted oral therapies for mutated lung cancers, they can be effective wherever the cancer is. So they can be effective if the cancer is in the lung, outside the lung, and even in difficult areas to treat, like the brain, which is a challenge because a lot of our drugs don't penetrate the brain. And so, another reason why it's really important to make sure that you're having genetic testing done in your cancer to make sure that you don't miss an opportunity to be able to have one of these effective types of treatments. Now, as with all of these targeted therapies, eventually the cancers can become resistant. And so, if that is to happen, the first thing I would really recommend is talking to your doctor about looking at clinical trials. Trying to find better ways to treat resistant forms of lung cancer is a really important area of research right now. But the other option that would be available would be things like chemotherapy, immunotherapy. So there still are treatment options if one of these medications stops working.